What if the answer to managing polycystic ovary syndrome, one of the most misunderstood and frustrating hormonal disorders, has been hiding in plain sight? Not in hormone pills, not in crash diets, but in a diabetes drug, a weight loss shot, a GLP-1. This isn't just a theory. This is the story of thousands of women who've taken matters into their own hands, off-label, off-script, and finally on track. Today, we uncover real stories, hidden research, and why so many with PCOS are turning to GLP-1 medications like Ozempic, Wegovy, and Mounjaro. Understanding PCOS. Polycystic ovary syndrome, or PCOS, affects up to 1 in 10 women of reproductive age. Yet it's still wildly underdiagnosed and poorly treated. It's not just about ovarian cysts, despite the name. Women with PCOS face a constellation of symptoms: irregular periods, weight gain, especially around the belly, acne and facial hair, infertility, and a high risk of insulin resistance and type 2 diabetes. Many are told, just lose weight. Take the pill. Try metformin. But what happens when none of that works? PCOS isn't caused by laziness, and it's definitely not cured by generic advice. The root cause for many women? Insulin resistance. And that's where the GLP-1 revolution begins. What are GLP-1s? GLP-1 stands for glucagon-like peptide 1. These drugs mimic a natural hormone that stimulates insulin, slows down digestion, suppresses appetite, and even reduces inflammation. Originally created to manage type 2 diabetes, drugs like Ozempic, semaglutide, and Mounjaro, tirzepatide, are now blockbuster weight loss medications. But here's the twist. Many women with PCOS are using these drugs off-label, without official FDA approval for PCOS, because they're finally getting the results they couldn't get from traditional treatments. The off-label use isn't new. What's new is the science catching up to the stories. Real stories, real women. Let's talk real stories. Meet Amanda. Diagnosed at 24. Gained 50 pounds in 2 years. Tried metformin, felt sick. Tried keto, bounced back. Then she found Ozempic. I didn't just lose weight, she says. I got my period back. For the first time in years. Then there's Layla. She wasn't even overweight, but had intense cravings, fatigue, and infertility. Her doctor prescribed tirzepatide off-label. After 3 months, she ovulated for the first time in over a year. And then there's the Reddit underground, where women swap GLP-1 stories like survival guides. Week 6 on Wegovy and my acne is gone. Mounjaro has literally saved my marriage. I feel like myself again. I cried today because my period came like clockwork. Of course, not everyone has a miracle transformation. Some report nausea, fatigue, and stalls. Some regain weight after stopping. But many say it's the first time they felt hope. What the research says. So what does the science say? Here's where things get suspiciously quiet. There are a few small clinical trials showing that GLP-1 drugs improve ovulation rates, weight loss, insulin sensitivity, even testosterone levels. One 2020 study showed semaglutide helped PCOS patients lose more weight and improve hormone levels better than metformin. Another trial in 2022 used liraglutide and found women had better menstrual regularity and reduced androgen levels. But here's the problem. Most of these studies are small, short-term, and not funded by the drug companies themselves. Why? Because PCOS is notoriously underfunded, and women's health, especially hormonal disorders, has always taken a backseat in pharma R&D. So while doctors know the mechanisms make sense, the official approval process is frozen in red tape. That's why more doctors and patients are going rogue. Let's be clear. Off-label doesn't mean illegal. Doctors prescribe medications off-label all the time, especially for conditions like PCOS where there aren't many options. But it does mean insurance probably won't cover it. And not all doctors are comfortable prescribing a $1,000 per month injectable drug without FDA blessing. Some women are turning to compounding pharmacies, where versions of semaglutide and tirzepatide are sold for less. Others are traveling abroad or ordering from telehealth startups. It's a growing, unregulated shadow market, and one fueled by desperation. But for many, it's worth it. Why GLP-1s may work so well for PCOS. Why are these drugs so effective for PCOS? It's not just about weight loss. GLP-1s help tackle insulin resistance, the root of the hormonal imbalance. When insulin sensitivity improves, ovaries stop overproducing androgens, like testosterone. Inflammation drops. Periods become more regular. And cravings stabilize. That's why even lean women with PCOS are seeing benefits. Because it's not just about BMI, it's about internal metabolic chaos. GLP-1s restore balance. At least for some. They also have other bonus effects. Improved sleep. Reduced liver fat. Mood regulation. Lower cholesterol. It's like a Swiss Army knife for metabolic mayhem. The risks, side effects, and unknowns. But it's not all sunshine and skinny jeans. There are real risks. Common side effects. Nausea. Constipation. Fatigue. Hair loss. Loss of muscle mass if not eating enough protein. Rare risks include gallbladder issues, pancreatitis, delayed stomach emptying, which can impact medication absorption. And here's a big one. We don't know what happens long term. What if you stop taking the shot? Do your hormones spiral again? Does the weight come back? And what about pregnancy? GLP-1s aren't approved for use in pregnancy, and many OBs recommend stopping them months before trying to conceive. So for women using GLP-1s to regulate cycles for fertility, it's a tightrope walk. GLP-1 drugs aren't a miracle. They won't fix every case. But they're opening new doors, for women who've had every other door slammed in their face. This is a story about hope. About taking control. About demanding better options, even when the system lags behind. The GLP-1 revolution for PCOS may be off-label. But it's not off-base. If you're living with PCOS and thinking about GLP-1s, talk to a real doctor, not a Reddit thread. Do your research. Know the risks. And don't settle for one-size-fits-all care. Because you deserve better. Subscribe for more videos where science meets real life. And share this with someone who needs to know there are new options. This isn't fringe medicine. This is the future. And it's already happening.